Welcome in, folks. It's time now for 814 Your Health. For that, we are here at the Caring Health Network in Altoona. I'm joined by CEO Dr. Albert Bruno. Dr. Bruno, thanks so much for having us here.
Thank you for having me.
So, for people who don't know about the Caring Health Network, what do you guys do, and what's your goal here in this area?
Well, we're a rural healthcare center originally out of Phillipsburg, and since 2015 we've been operating. So we provide primary care, pain management, mental behavioral health, and chiropractic care to the community. We opened up the Altoona location as a multi-specialty facility that also provides pain management, mental behavioral health, and chiropractic care. Soon we'll add primary care here as well.
So one of the things that you can find on your website, and it's something we've talked about a little bit, is how you take a full approach to kind of healthcare. It's not just the physical, but you also take mental and other characteristics in it.
We do. I thought about this for a long time when we offered pain management, and I came up with a protocol for pain management that integrates behavioral health along with chiropractic into it. We utilize behavioral health as kind of a gatekeeper into pain management. So when a person comes to our facility, they're evaluated to determine whether or not narcotic therapy or opiates are appropriate to begin using with them, or if there's something else that needs to be addressed. In addition to that, I found that most people, rather than just taking a pill to help themselves, need to do something physical more, to participate more in their health care. So we integrated chiropractic and physical therapy with that as well. So that approach, we get a lot of really good results. When surgery isn't an option for somebody, then you've got to find something that works for them. And so we found that integrating the two with pain management really works the best.
Well, that and with someone being in chronic pain, that has to do a little bit to their mental health as well.
A lot. It wears you down. So what ends up happening is it interrupts your sleep patterns, it interrupts your eating patterns. If you gain a little weight, if you don't sleep well, it affects you in many ways that people don't realize. And so those are the things that we identify and try to address to kind of get you jump started back on track.
Now, of course, right now in the time we're living, COVID testing has been a big topic with every healthcare network. Tell us a little bit about what you guys offer and how quick your results are.
Well, we offer COVID testing at our Phillipsburg location and Altoona location. So we do antibody serology testing, blood draws, we do PCR nasal swabs, and we do rapid testing. So the rapid testing results in 15 minutes. The PCR nasal swabs, we result in most cases 24 hours, generally never outside of 48 hours. However, we do a different type now of dry swab, which we can result in hours. So if you have your test done by 1 o'clock, generally 2 hours later, we'll give you your results. The exciting thing is we're working on a bridge study right now to do saliva testing. So pretty soon, once that's completed, we'll be able to take a saliva sample from you, test that for COVID-19 virus versus taking a blood draw from you to test for it, which in some cases that's appropriate to do that, or a nasal swab, which can be uncomfortable, but right now that's the best test to do. So we're looking forward to that, getting that completed, and hopefully we'll have that done inside of 4 to 6 weeks.
Wow. And then is that something that you're able to, I mean, obviously people come in here who are patients to get that test, but schools and businesses?
Absolutely. That's what we have in mind for that, not just the general person, but the educational institutions, employers that have employees that need tested. We get boroughs that contact us, home nursing facilities, skilled nursing facilities, assisted living facilities. That's something that we're hoping would be more beneficial and easier to test for people. With the PCR swab, if you don't do the test right, if you don't take the sample right, it won't result right. You'll have to do it again. So just taking a saliva sample, there's little that can go wrong there.
And then finally, are you guys accepting new patients, and how can people find more information about you guys?
We are. So with both locations, we do same-day patients for primary care, pain management, mental behavioral health, in most instances in chiropractic care. You can find more information on us by going to the caringhealthcarenetwork.com, really caringhealthcarenetwork.com, or follow us on Facebook. Our website will give you all the information you need to know about the services we provide and COVID-19 testing. You can become a patient online, call us, or find out what information you need to become a patient through Facebook.
Dr. Bruno, I want to thank you so much for having us and taking the time.
It's been a pleasure. Thank you.
Folks, we have much more still to come in the show today. Stay with us.